better than standing at the podium. We'll continue to collect cards, but I have a nice stack already, and the challenge is we don't get as many that reflect, Joanna, on your presentation, but hopefully as some of those come in, we'll integrate them in, and I don't want any of you to be shy in joining in the responses to what's come in. Usually I would start with a bunch of follow-up questions, but I actually think these questions are so good I'm just going to use them. And here we go. So let me just start with a question that came in. It was focused on kids, but I'm actually going to broaden it out. Someone says kids move in, poor kids move more, but actually we do know that people with lower incomes move more than those with higher incomes. This question is they take their ACEs with them, but really my question, again, I'm just going to take this as a point of departure, is we're talking about community in lots of different ways. Engagement, connection, accountability, data, and how do we take into account mobility in program design, in measuring results, in efforts at engagement, particularly given the higher level of often quite disruptive mobility for those at greatest need. Who wants to start?
I can give an example of where I think it's been done well. In Los Angeles, we have some communities where the elementary school, almost the entire population of the elementary school turns over in a year. And so that, the ability to deliver an education program is almost it's impossible because the kids are moving so fast. There was a project there that I was involved with called the Elizabeth Learning Center. And what they did there in this area of LA called Cudahy, where it was massive residential mobility, the school got transformed. And at the school, it went from being a K-6 to a K-8 to a K-12 school. They built a family center on the school, a health center on the school. The family center provided employment support, training parents who were mostly working as domestic workers and part-time work, and provided preschool and Head Start and early Head Start. So what ended up happening is at this one site, it provided for the community, in a sense, and to these parents, Social Security. It was a new form of Social Security. So that they had their kids in a child development program, basically from birth through 18. They knew where their kids were going to be, and then provided other kinds of resources and services. And what you saw happen in that community is the residential mobility decreased rather dramatically, because there was an anchor there in the community to actually hold the families there, and it no longer was a transition place for them to move out of as soon as they could get a leg up. So one of the things to think about is how do we do community development in a way that anchors families in ways, and making connections to health, to support of their children, and also tying family and parents' development to their child's development was also very important. So you had a kind of two-generation model that supported their living in those communities.
I think it's a great question. In addition, we have to think about community not just in our geographic definition of community, because my community is all over the country, and because it really involves the social supports that we have. And as people move to different areas, being able to maintain that connection to those community supports in community in the loose definition is really important for that continuing to thrive effort as well. So there's also what Neil is talking about in having people to stay in their communities as they progress, especially in underserved communities. Your job is to get out of the community. That's what you're supposed to do. You're supposed to get an education, and you're supposed to move to a better place. When we forget that that better place is where we started, oftentimes in working to encourage people who are making those changes to remain and be a part and reinvest in the communities where they started.
Just one other,
Yeah.
another idea in that regard is that, you know, the turn of the last century, we had settlement houses that dealt with people that were moving a lot and trying to integrate them into communities. What you're seeing now develop in many places are what I would call settlement houses for the 21st century, which are family resource and health centers in communities. In LA, there's something called the Hope Street Family Centers, and in many other places, they're building these places that actually can serve as sort of settlement houses for 21st century.
So, Shannon, I want to see if you want to weigh in on this, but I'm also going to bring in two questions that came in about gentrification and displacement, that often as you invest in making places more livable, you also drive out those who live there. And so if you could bring that into this discussion as well.
And actually that was going to be my response, is that, so we deal in the permanent because we're dealing in the built environment. And I think what we can say is if you can address the inequalities that we see in the built environment, then it's less of an issue if individuals are moving. So what we see is that where you have high health disparities and economic disparities, there are equivalently high disparities in the infrastructure in that community. So there are more deteriorated sidewalks, the parks aren't well maintained, there are no bike lanes, maybe there are no sidewalks. So I think that the gentrification issue always comes up. I always have this question. I usually avoid answering it. Try. I think what we're looking for here is a parity in the built environment, because everybody has the right to a well-designed place to live. Everyone has the right to a walkable park, and that shouldn't be a matter of only a wealthy community has that. And that's the role of government, for goodness sake. We all pay taxes. Everybody should be getting an equal share. So if the community already has a well-maintained park, it doesn't need more resources for a well-maintained park. All the parks should be at an equivalent level. And I feel like gentrification is not something that design can address. Design can address inequalities. I think gentrification has to be addressed at a policy level. So that's how I usually.
Let me shift to another topic. It sort of has to do with scale, and I think, Ira, I'll start with you on this. As we talk about integrating health, and you left us with an image of reaching up to the community, a lot of the other entities, you know, we're so big in healthcare, and there's a lot of consolidation, but a lot of the entities that are community-based are small, nonprofits, very shoestring operations. How do we work with those in ways that don't encourage or perpetuate fragmentation in care delivery? When we think about consolidation, we worry about the market, the loss of market forces and market power, but we also see opportunities for integration of data systems, investment in evidence base that improves care. This proliferation of community organizations is often doesn't have those kinds of resources. So when you're thinking about interacting with community, how do you think about the scale issue and the relative scale of your institution and these others?
Absolutely. I think that's a great question. When I think about that, I think about what we talked about yesterday in terms of community benefits and how is health systems, how we use community benefits now versus how we can use those community benefits to reinvest in the communities that we serve, in the sense that we have the ability to gain data and to take that data to inform need and to inform location of need. Then why not take the community benefit that we already are responsible to give and give that back to the community in a way that we reinvest? And that's a model that we can then replicate in different areas. We can provide a framework that can be replicated. That's a great example that we have with Community RX. Community RX is an investment in the community, and it's identifying solutions that work with the community and each individual need, but they scale. It scales because you can take that framework and you can plop it from Chicago to New York to some other places, and what they create and what those solutions are may be a little bit different, because the built environment that you need in New York is completely different than the built environment that you need in Mississippi. But those principles and those things that you follow, those toolkits that you follow, can translate. And that's the way we need to be thinking about it.
Another way to think about it is you have all these community-based organizations, and from a complex systems standpoint, these are all agents in this community. So the question is, how do they become aligned in common purpose with the health system or healthcare system? And again, having common outcomes or common measures that one uses as a way to promote alignment, and then also to be able to put a process in place where people can build trust. And that's oftentimes done through specific named community initiatives that build over time, but building into them the ability of people to work together, to learn together, and to achieve together, and to be able to celebrate those achievements starts to build that kind of more unified common vision and common sense that they're in it all together. You know, I think, you know, in the children's health and children's advocacy world, this is really important because in any community you go, you have lots of children's community-based organizations. If any place that we need mergers and acquisitions, you know, is to consolidate a lot of that into in a more useful force working together. And I think one of the challenges is how, you know, do we not, you know, from the health system colonize these efforts, but actually help raise them up in a way and help allow them to align and provide the support that allows them to take the leadership role in that regard.
I think one of the things that I would just flip in that a little bit in talking about that alignment is making sure that we're aligning about what really matters to the community, because we talk a lot about what's the matter, and we know what's the matter. But what really matters to that community in that process of building trust, we got to start with what matters to them, and then go from there. Because if we don't start with what matters to the community, if we don't start with listening, then we're not going to be able to establish that trust, and we're not going to be able to have that sustained, prolonged relationship, so that we can get to that place where we're aligning. So it's going to take time. It doesn't happen overnight. We didn't get where we are overnight. We're not going to have a solution overnight. But we've got to start by listening and maybe not doing the thing that we want to do or we think is our top priority, so that we can build a trust to say that we're in this for the long haul.
I'd like to add that I feel like the input of the community to us is so valuable because we don't have the resources to be on every corner and have an intimate knowledge of exactly why this park isn't working or why nobody's walking down that street. The community knows that. They have those answers. They'll tell you, that's really windy and the garbage always goes on that corner and there's no way I'm walking. Or that street light's been out for the last 2 years and that doesn't feel safe. That kind of specific and intimate knowledge of a community you can only get from the people who live in that community. And it's essential for a positive outcome of design. Like that nuance is what makes design so rich and allows it to be unique and allows it to uniquely respond to that community. And then it will be successful because it will actually respond to the needs of that community rather than my perception of what that community needs and I, from on high, impose it. That is absolutely not an effective way to design.
Let me shift to a question about rural communities. And again, I'm going to pose this fairly broadly. Each of you drew on examples and discussed models. Most of them were fairly large scale. Can you give examples of your thinking, your work that apply in rural settings? Maybe Joanna, can you start with that?
Absolutely. So we, my partnership director is here somewhere. Suzanne, who's here, has just been working with Richland County in Mansfield, Ohio, very small rural community, agricultural-based community. And they called us in, not because of necessarily a health issue, although they had kind of health issues, but really because they were losing the millennials from their town. And their town had become very car-oriented. Although there was kind of an intact downtown, nobody was using it. It had been bypassed, or I don't know, some large box retailer maybe had come along. These things happen. So how do you use active design? How do you use design to create those walkable communities, which we know are so desirable to younger populations, and to keeping in their instance, keeping the younger generation. And so we did like a whole process where the community came in large number. And actually there were a lot of existing pieces of work being done by individual members of the community, and everybody knows each other. So in a way, it's maybe a more effective community outreach process, because there are already those bonds and trust between the people in the community. And so through doing a workshop and bringing everybody together and walking around the neighborhood and really feeling and understanding what the challenges, what the opportunities were for that neighborhood, listening to all of the people in the community who were already working and doing pieces and what they needed. This was only 3 months ago, and because the workshop resulted in this shared vision, they have been able to do so much so quickly, because all of this stuff was kind of happening, but nobody was bringing it together. And that was a rural community. So, and I think Lamar also here in Colorado, we talked, Jay Brooke, who's here somewhere, talked about Lamar, which is one of the communities that the Colorado Health Foundation has funded. And they've been incredibly successful because the whole community turns out for events and everybody's invested. And so I think that working with rural communities, the outcomes are different, but the process is still very similar.
I'll give two points. So my parents don't live in a rural community technically for Mississippi, but I'm going to talk a little bit about technology and a little bit about policy. So for Christmas one year, we gave my mother-in-law an iPad, and we gave my mother an iPad. My mother-in-law is in her 70s, and she is a gadget queen, and she uses that technology to communicate with her grandkids, to FaceTime with them. She uses it all the time. She loves it. My mother, that iPad sits on her counter as decoration. It's wonderful decoration for her. But my father has dementia and a chronic medical condition, and the reason that we can keep him in home is because we have a nurse who happens to be a family friend who comes in every day to relieve my mom and to provide care for him each day. And the way that we communicate and the way that we use that technology is so that we can do FaceTime with his care provider to inform us how things are going. So she can show me what I need to see, and she can also connect my mom to things that she needs to be connected to on our patient portal, whatever those things may be. So it's a way of using technology remotely, because I live all the way in Seattle. My brother lives in Long Beach, California, and my other brother lives in North Carolina. None of us live in Mississippi where my parents are, and they're both in their 80s now. But we use technology to maintain that connection and to maintain that communication. And I say that to think about the rural context and working with rural communities and how we can use technology in various ways, not just in that simple FaceTime, that's the simple way that we use it, but in many, many other ways to connect health and healthcare with communities and create the possibilities for feedback and behavior change. But to be able to do that in rural Virginia, there was a challenge for the providers because they were expected to use medical records and electronic medical records and communicate with a portal, but there was not enough broadband access. So the community came together and worked on policy to bring in and encourage the businesses and get the community to bring in the businesses to increase the broadband access in those rural communities so that they could make the connections that they needed to make to folks outside of that rural community. And it speaks to that coming together and conversation and community to sort of take that next step. So there's this opportunity to use technology to bridge some of those gaps that we haven't been able to do before. There are many, many other steps and other ways that we can do it on a local level and a policy level, but that's just one example.
The TEX initiative that I talked about in terms of transforming early childhood community systems, you might have saw in the brief instant the map was up, that we have several sites in Texas, which wasn't planned. It sort of just emerged out of some issues that happened in Texas. But down on the border region, we're working with a couple of counties there where, because we're measuring kids' healthy development in age 5, and it's not a sample, it's all the children in the area, we're able to map and using geocoded mapping. We can map it in various ways that makes sense to that rural community. And then what we're doing now is working with that community around creating a network out of the assets and resources that they have, and being able to map those also, so that other parts of the ecology there understand where else other resources are, and then beginning to network them so that they can actually build their own network and do that. So there are ways in which this kind of community health or population health focus can be customized in a way so that it actually serves the purposes and builds the assets in those rural communities as well.
Got a question about environment in a different sense, as in environmental health. Joanna, you mentioned the development on the brownfield. And I should say, when I told the story of the creation of the Department of Human Services and Healthcare Policy and Financing here in Colorado, we had another change at the same time, which was we created then the Department of Public Health and Environment, bringing environmental health and public health into the same agency. So that suggests that at the time there was an understanding of the relationship between the two. Again, we've talked a lot about social context built, but there are a lot of literal environmental health factors. How do they play in to efforts to improve health?
Sure. I mean, I think in a lot of ways. So what was great about the Building Healthy Places initiative is that we actually made that jump to looking at environmental triggers. So we looked at noise pollution, maybe not something that you potentially think about, but very stressful and definitely adding to chronic disease. So noise pollution, light and air, access to views of nature, obviously pollutants and any kind of stresses in that kind of way are an obvious issue with health, but I think there's also the mental health issues which we can really kind of begin to address in some part with design. I think the great thing about encouraging people to move more and to eat more fruits and vegetables is that it automatically has a positive impact on environmental sustainability. Because if somebody is walking rather than driving, they're obviously reducing the amount of carbon they're using. If you're using the stairs rather than the elevator, likewise, you're just reducing the amount of reliance really on kind of vehicles or motor-driven pieces. And then there's just these great synergies. We actually find the easiest people for us to kind of get to adopt active design or evidence-based health design are the sustainability community, because they have already gone through this. They understand that they can have an impact on this larger issue using specific and tangible strategies. Some of the things like bioswales. Bioswales are something that are great for the environment. They reduce flooding. They reduce runoff. They help to mitigate storm water, which then ends up polluting our rivers if we don't offset stormwater buildup. So one design strategy can have all these multiple different effects. Planting trees when we walk down the streets, great for our mental health, great for encouraging physical activity and walking, but also great for the environment, because not only for cleaning the environment, but also shading and cooling the environment. So I think we just have to be savvy, and we have to educate ourselves about all of the different ways that we can impact environmental sustainability along with health, because the two go hand in hand. And the better that we are about articulating the synergies, the broader the appeal that we can have, and the easier it is to persuade people that these design strategies or this approach is one that's going to address a lot of different priorities. So I think that the two are very much aligned and hand in hand.
part of the way that we've been trying to look at this is we use this, the Bronfenbrenner ecological model. So we start with children and families, we move out to what are the things in their local environment, out to the community, out to the policy and to the larger environmental context. Part of the problem is sort of once you do that, how do you bring things together to actually make change? And one of the problems we have from a public policy standpoint as a pediatrician working on these issues, because we're trying to optimize the development, there are environmental factors that are pushing down like lead and other kinds of things, is how do you have a discussion about that? And oftentimes what ends up happening in any community is there's a kids' table, policy table, right? And it's only about 1.5 feet off the ground, and sitting around it on little chairs are pediatricians and preschool teachers and early ed, and all the kids people are at the little table. And there's this other table where the mayor sits and the police chief and the community development people and all of that. And then they might have another chair, another table where the environmental people, because they don't actually really. So part of what we're trying to do with the data that we have and creating a new narrative is to be able to map that early childhood data with crime data, to map that early childhood data with housing data. So you can look at housing insecurity and how children are doing. You can look at crime data and how children are doing. Then you have a conversation with the police chief in which he's saying, gosh, when we lock up the 14, 15, and 16-year-olds, they're really the same kids that we saw at 1 and 2 when we went in for the domestic violence thing. Maybe we should be thinking about upstream policing. And it's the same thing with the housing folks. How do we think about community economic development and our environment and rebuilding things in a way that raises this issue? So it's not just the kids' issue at the kids' table, so that now it's the community's issue overall. And the same thing with the environmental folks is sort of how do you start looking at where you might have brownfields or places that are toxic waste cleanup sites. How do you start to map those as well so that you're actually taking them into account so that everybody's starting to sit around the same table and you start to rebuild that issue of community, that we're all in this together, that we do have this connection together, and that things like how our children are doing and thriving are something that we all have to own and contribute to. So I think there's ways of using data and new narratives to sort of bring and set a new type of table that we can take that on.
So I was just going to, I hadn't mentioned, and something that is fundamental to our work is exactly what you're talking about. At any given table, we have people from across the spectrum. So we have to have a multidisciplinary approach to this, multi-sectors. In our office, we have health researchers, designers, communication people. We have everybody at the table. And it's the same. When you're talking about a given subject, you need somebody from the community. You need all kinds of different professional expertise, some completely from left field. And then you need elected officials, and you need the policymakers. You have to have one conversation and bring in all of the different pieces.
I think all of those I think all of those factors are really crucial. I'm going to bring it, they kind of go, and then how you have that macro, you go out and you go to the specific thing. And so I'm going to give an example. We have a PCORI grant, and that PCORI grant focuses on asthma and improving health outcomes for asthma for underserved kids and minority kids in the Washington, D.C. area. And as a part of that study, it's a patient-centered study, so we worked with, we had parents of children with asthma come and speak to us about what are the factors that contribute to you not being able to effectively manage your child's asthma, and what are the things, because the premise of this was how can we help to reduce parents' stress levels so that they can more effectively manage their children's asthma in treating their asthma as a chronic condition as opposed to an episodic condition. A mom speaking to us said, she was on top of everything with her kids. She said, but I can't cook in my oven because there are mice droppings actively in my oven. And that contributes to my child's asthma. And I can't do anything about that because I've asked my landlord to fix it, and they haven't come to fix it. And that's stress, and that's environment. and that's vulnerability, if we want to use that word. And what that mom needs is a medical legal partnership. And that is, and what we have to think about is how do we empower, what systems and what processes can we put in place to empower people in communities to, it's great that we, that we sort of are advocating, but how do we empower people where they are right now to change and impact their environment? And I would say medical legal partnership is one of those powerful things that we can do to support families and communities.
So we don't really have time for a round robin of more questions, so I am going to ask two questions together where I think the second question is the answer to the first question. So the question asked was, most of the private sector investment is focused on healthy, wealthy, while public health is cost. How can we make the business case to invest in the most vulnerable? And then I got another question. With the focus on population health and prevention, why are hospitals continuing to build more facilities and more beds? So I think at lunch, this is your homework. You can try to figure out the answers to these questions, because I know that business case and business models are critical. And there was also a question about the sustainability of some of the development ideas, Joanna, that you went over. Ivor, you said you were an optimist, and I always say that when I give a talk, and then at the end of the talk, no one believes me. I want to end on an optimistic note as well. We kicked off the morning by singing Happy Birthday to Medicare, and I snuck in Medicaid too. I want to remind you all, as we think about the breadth of issues we talked about today, the importance of connection, but also the roles of social context, that Medicare desegregated the American hospitals, that in order to participate in the Medicare program, you could not be separating by race. And so it's a sign that for whatever limitations we face in using the power of the purse, we can also motivate very important social change when we use our public resources effectively. So I hope we've given you some good thoughts for today about a lot of different dimensions of how community relates to well-being. I'd ask you to join me in thanking our presenters for today. And we will reconvene for the speaker promptly at 12:15.
I'm Emily, and I call Lamar, Colorado home. And I call Lamar, Colorado home because I choose to be here, but I really choose to be here because this community is inspiring. It makes me want to be a better person. It makes me want to be a better professional. It makes me want to be a better mom.
For people in the community that are currently unengaged, I would really recommend that they find what their passion is and just move forward. To take the momentum that we're seeing in the community and work with it and try to find the area that best suits them, whether it be sports, whether it be the arts, whether it be economic development, our downtown corridor. There's lots of places for people to volunteer their time and make this place a better community.
I've lived in Lamar since I was 2 years old, so this is home to me. You know, this is our town. This is where we live, and there's so many opportunities out there and so many things going on, positive things going on in Lamar, and you know, we just want everybody to step on board and help us out.
I believe that people should get involved to make the community more active and healthy. We might not have the changes yet, but to visualize it and use the resources we do have now, it's helped a lot.
What is exciting about where we are right now is that we have a chance to do all of that through this program, through Healthy Places. Personally, I love the concept of Lamar Loop. I love this idea of a 7-mile trail. As my family goes out and walks now, half the time we're on sidewalks, the other time we're tripping over cracks in the sidewalks, or we're in the middle of the street, or we want to go out and bike together. It's really difficult to find a safe place to do that. So the Lamar Loop just really offers that opportunity, and I think for us, it's just a great family activity to do.
What I'm mostly looking forward to with Healthy Places is I'm looking forward to a more healthy community that I can continue to raise my children in. I'm looking forward to being more health conscious myself. The 7-mile loop is going to be incredible for those of us that run, walk, bike, anything. There's so many great things coming down the pike.
You know, we've talked a lot about the economic value of healthy places, that, you know, if companies or anything comes to town and they see all these activities, all these new things going on, it's only going to bring more businesses in.
I am a runner, I'm an avid golfer. I really enjoy getting out and being active because I have a desk job all day, and I can really appreciate the fact that I need to be more active to be healthy. It's great to see a lot of focus in this community about healthy places, because we're not a very healthy community, but we're becoming one.
There's some good things happening, and there's definitely a way to pull ourselves up, and what we're doing and how we're coming together and how we're going about some of this. The people who are looking into our community are saying, you guys have it together. You're going to do something big here.
This isn't the last or the only park that we are going to build. This is the first of many, the first of a lot of efforts to make sure that we have equity in this city. That no matter where you live, you matter.
1, 2, 3, yeah!
He vivido aquí en Westwood por más de 10 años y algo que me encanta de la comunidad de Westwood, que somos muy unidos, trabajamos muy duro para obtener las cosas que tenemos.
Lo que me encanta de Westwood es que hay mucha gente hispana, hay mucha necesidad y creo que tenemos la oportunidad de brindar toda la ayuda necesaria y hacer un cambio.
So I've been working in the Westwood neighborhood for 8 years, and ever since I started working here, there has been a lot of passion and dedication on the part of the residents. It wasn't until we were funded by the Colorado Health Foundation for Healthy Places that I finally felt like the momentum turned and the residents were being rewarded for their hard work, and now they have the resources they need to create their visions.
Mi trabajo como conectora en la comunidad de Westwood es estar brindando toda la ayuda necesaria con todos los recursos que tenemos aquí en el área.
80% de la comunidad es latina, así que me encanta esta comunidad y estar aquí es algo que me gusta mucho. Algo que me gustaría mejorar sería obviamente la transportación, que queremos que mejore para que nuestro barrio esté un poco más comunicado con cosas.
Bueno, personalmente para mí y mi familia estamos viendo el logro o el cambio en lograr tener una plaza, un barrio más tranquilo y que se logre tener más actividad física.
Algo que espero de lugares sanos y lo que más me emociona sería las clases de ejercicio para las madres y para los niños en conjunto.
Getting involved is very important, and the voice of residents is extremely important. Now, I think Healthy Places is doing a good job of that, representing those, but the more people that get involved, the easier it is to create change.
Y esos logros van a llegar al futuro, a los corazones de nuestros hijos.